And you're seeing the slides advance. It says learning
Yep.
objectives.
Yes.
Okay, perfect. All right. Yeah, so today I hope to, sorry, okay. So I hope to start off by defining climate health informatics, understanding the dual role of healthcare technology and AI in the space as both the climate adaptation tool, but also the climate driver that AI is in terms of its computational energy use. And recognize these new responsibility boundaries that are created when care decisions kind of go across distributed networks, and how we can bring a systems thinking framework to how to think about AI in healthcare and make sure we're doing this in a trustworthy and responsible way. And yeah, just to highlight a bit more, Brittany went over my background. So I'm someone who is still a practicing physician. I see patients in primary care pediatrics now in New York, but used to be in California, and also have worked in industry, but now really rooted in academia. But part of my background too of why I got interested in this work really stemmed from while I was living in California in 2020 during COVID, was taking care of children in a federally qualified health center in the Bay Area, largely a population of children who had recently immigrated from Central America. And we were in the midst of COVID, but we also had some of the worst wildfires in California history at that time, and was seeing the impact of wildfire smoke on children I was taking care of, from triggering asthma to the mental health burden. But most of the information around environmental factors like air quality never made its way over to the electronic health record. And so that was really the spur for me over the last 5, 6 years of really getting into understanding where informatics, data, AI come into better understanding the climate health nexus and how we respond to it. And so, just some grounding information that many of you are probably already familiar with, but increasingly we're having quantification of the health impacts of climate change. I think there's this one report from the World Economic Forum that came out a little bit over a year and a half ago, or 2 years ago now, that started to quantify the excess debts and economic costs of just direct climate change impact. And I think many think that this is probably an underestimate, but we increasingly are understanding the many different drivers and pathways through which climate change impacts people's health. At the same time, we are also understanding the US healthcare system's huge responsibility in contributing to that climate change, where we have a significant amount of emissions, and the US healthcare system is responsible for 25% of global healthcare emissions, despite only taking care of 4% of the world's population. And so these were some of the motivating factors that I started to see in the informatics communities that I was part of, more from the lens of healthcare systems. Those are the spaces that I was in more regularly. But I know these conversations are really happening in public health and at a policy level as well. And so this diagram was one that we created at the very first AMIA Climate Health Informatics workshop that we hosted back in 2023, and really helps to connect these many pathways where we know that climate change through these different climate drivers and exposure pathways directly impact the health of the general public, of agencies, the ability for healthcare systems to respond. And at the same time, we know that healthcare systems are contributing back to climate change. And so it was a framework diagram from which the climate health informatics community was starting to outline where are those places that we could start to make a difference. And these were just some of the topic areas that came from that initial brainstorming. And I'll go through a few of these in a little bit more detail. But in terms of creating resilient systems and adapting care to changing climate down the center, to how do we use informatics systems to actually drive healthcare to be more sustainable, and how do we better advance the knowledge of how climate change is impacting health. And I'll talk a little bit more about the sustainable healthcare and advancing knowledge slides in just a moment. But also know that, this emerging field of climate health informatics that's started to emerge more from the informatics community also sits across a lot of disciplines that have existed for a long time, whether that is public health, environmental health, sustainability, emergency preparedness. And part of this is that there's a lot of overlap across these different domains. And sometimes I think part of where the informatics community has found this framing of climate health informatics to be helpful is in bringing together the urgency of how climate change is rapidly changing all of these factors because of the scale of how rapidly the risks are growing. And so to get a little bit more specific into some of these areas with different examples. So in sustainable healthcare, this is really around the scope of how do we reduce the greenhouse gas impact of the healthcare system. And some of the core informatics challenges and opportunities there are around data standards to better quantify greenhouse gas emissions, particularly from scope 3 emissions, nudges like clinical decision support to actually help care choices be more sustainable. On the adaptive care side, how do we actually bring, for the example I gave of children being exposed to wildfire smoke during asthma, how do we actually start to bring environmental information like air quality index into care models such as childhood asthma plan in terms of what their asthma inhaler plan should be, resilient systems that apply really not just individual healthcare system, but thinking about this at the public health level, thinking about how data standards across a geographic area help to connect the dots, such as thinking about some of the challenges that happened during the wildfires in Los Angeles last year, where different agencies were sending alerts to patients of where it might have been safe or not safe with the wildfires, but agencies were working with different environmental data sets. And so there was a lot of confusion over which alerts were going out. And so there's a lot of work that needs to happen in how public health, healthcare system infrastructure and responding to climate challenges needs to be better coordinated. And then advancing knowledge really to better identify how healthcare outcomes can be linked to climate-driven change. And I'll go into that one with a little bit more specificity. So there's a lot of work that's happening around being able to better, and many of you here might be involved with this type of work, but a lot of work around how do we better code the different climate health challenges. And so this specifically, this article from Scientific American from a colleague Nilu Tumala, who's a surgeon and climate health trained physician in New York, had written this article about how a child who shows up in the ER with trouble breathing, potentially due to higher levels of ground ozone that could have exacerbated his asthma attack, is still only coded with asthma attack in terms of the ICD-10 coding in the healthcare system. And this had led to a lot of work from colleagues like Stefan Wheat, Emily Spirelli. Stefan is at the University of Washington in exploring where there are gaps in the ICD-10 and other other coding infrastructure for the gaps in a lot of climate-driven health issues. And then there was further work by a colleague in Australia, Zarina Tompkins, who was starting to map a lot of the disaster hazards to SNOMED CT, one of the ontologies used for diagnosis and used more globally. But a lot of these efforts only get part of the way. They only start to map the hazard or environmental factor to a specific code system that we may have. But on the front lines of care, a lot of the challenges are that ER physician who sees that patient may not feel like they have information to say definitively that they can attribute that environmental risk factor to that specific diagnosis. And I think there's interesting opportunities here because we're starting to see ambient scribes be used in clinical encounters. And ambient scribes may be an interesting tool for better bringing together the more unstructured data of someone who had shared an environmental exposure with more structured data around what their diagnosis might have been to better understand from clinical data what some of the exposures and attributable outcomes might be. So I think this is an area with a lot of work that's happening in it. but I'm going to switch gears to really the rest of the talk is going to be focused a lot more on the sustainability side and specifically looking at AI and sustainability in healthcare. But to set the stage, and then when we think about healthcare sustainability with informatics, there's really two broad buckets that we can go down. On the left-hand side is this idea of how do we use informatics tools to make care more sustainable, or a concept that we had developed in the informatics community called sustainable care pathways. And this could look like a couple of different things. So there's a lot of health systems that are using clinical decision support tools to nudge greener choices of care. So this could be in the prescribing of inhalers. We have a lot of research to show that meter dose inhalers compared to dry powder inhalers are a lot worse for the environment for the treatment of conditions like asthma and COPD. And so there's been a lot of effort around nudging prescribing clinicians to switch from meter dose inhalers to dry powder inhalers. There's some estimates, such as from the NHS, that show that up to 3% of the NHS's entire greenhouse gas emissions come from inhaler prescriptions. So, that's an area where informatics tools like clinical decision support can nudge better care choices that reduce overall footprint. There's also a lot of work around how choosing telehealth, and now we have telehealth that gets augmented by more remote tools, whether they're wearable tools for remote patient monitoring or AI chatbots that can help make a telehealth experience more robust to really prevent in-person visits. That lack of travel has been shown in a number of studies to significantly reduce greenhouse gas emissions. So there's this whole world in which technology broadly can actually be used to make care more sustainable, whether it's the choices that it nudges or what the care models that technology itself enables that reduce transportation. But on the whole other side, we have to really acknowledge the footprint of health IT itself. And so the kind of on the right side, that circular diagram at that bottom, that is a framework. And sorry, it's too small to actually read, but if anyone's interested, I can share some of the links afterwards. But it's a framework paper called iClimate that was in a informatics journal about how do health systems start to think about the overall footprint of the computers they buy, of all of their IT systems, what is the life cycle of those products, and how do we make choices that looks at that entire life cycle to be greener. So there's that whole side of a lot of hardware decisions, but also software decisions that get intertwined. But then all the way to the right is this whole question of data-driven AI tools that are increasingly being rolled out towards all aspects of healthcare, public health, and really society at large, really with large language models, computer vision tools, other deep learning methods. And so there's increasing concern about the footprint of those tools. And so, but it's balanced by also a lot of the areas in which people are excited about what AI can do for climate health. I think on the predictive model side, people think that AI tools may be able to better predict when wildfires may happen and where they may happen so that we can better respond to those crises. During an environmentally driven crisis, AI-based chatbots can potentially provide more personalized guidance to the general public, to individual patients. I talked about some of the advances in climate coding that can happen with ambient scribes being able to better pick up what might have driven someone's environmentally exacerbated condition. There's also this concept of AI being able to optimize energy use, where healthcare systems have a lot of lights and power and equipment that's always running. And there's some articles that suggest that AI-based optimization of where energy is being driven to in healthcare settings can actually lead to more savings than the energy that it consumes. But I think the challenge right now is we're in a world where none of this is really being quantified. And it is also very hard to quantify, and I'll get into some of the challenges there and the nitty-gritty of that. But I think it's important to remember we're really excited, I think, across the board with a lot of the places in which AI can help. And I think whenever there's a really transformative technology there's a natural inclination. There's a lot of money and resources that go into rolling that out. But I think we're in this really unique moment in time where we are making the decisions right now for all of the infrastructure out there that is going to be baked into how our healthcare and public health networks operate for the next decade plus. And so small decisions that get made today can have huge ripple effects compounded over the years in terms of the energy and resource use impact. And so in the lay press, you've probably all been seeing articles like this that AI is dossing the power grid. One of the first quotes that came out that still has questions about the exact verifiability of it, but I think people think it's generally a good estimate that, and I think this was with ChatGPT 3.5 or 4.0, that a ChatGPT powered search consumes almost 10 times the energy amount of electricity as a search on Google. We're starting to better understand how much energy and water these data centers start to use that power all of our AI. And the Washington Post had this really great infographic looking at, a 100-word email generated by an AI chatbot using GPT-4 requires about 500 milliliters of water or about the amount of electricity to run 14 LED light bulbs for 1 hour. The interesting thing about this calculation is so it's really based on the data centers that are powering this, but depending on where that data center is located and the energy source that's powering that, this can vary significantly. I remember with the water use, I think from this article, if I remember correctly, a data center that is in Virginia was closer to 500 milliliters of water, whereas the same data center in Washington State was closer to a liter. And so there's huge differences. And when you think about this at scale with the number of calculations and the number of AI, the amount of AI use that's happening, all of those small differences really start to add up. And so there have been more and more forums that I, was invited to initially to, along with a lot of the collaborators that I work with, to start to get into this space more directly. And it started for me in particular back in New York Climate Week in the UN General Assembly in 2024, where I was invited to this roundtable from Axios, really talking about this question as a key issue of the environmental footprint of AI. And that was kind of the beginning for me of starting to assemble a team of trying to quantify this information of how do we know the exact footprint here and what are the different trade-offs that we can make, because we are in a world where we're not, the AI cat is out of the bag, metaphorically speaking, and I don't think anyone thinks we're going to a world where we're putting, AI back in the bag, but there are a lot of opportunities for a lot of decisions that go into tweaking how we use AI. And so we've started to see more and more publications come out around the best practice. This was one of the first publications that came out of Japan that was starting to call for this intersection of thinking about AI and healthcare from a perspective of sustainability. A lot of high-level recommendations and that were a really good call out. And this was helpful in some of the initial guidance where we started our work. But what we really wanted to do was try to be able to get to this question, what this paper shows for healthcare. So to walk you through what you're seeing here, this is a New York Times article that created that was looking at a paper that was published where a team of researchers looked at 5 different tasks: abstract algebra, high school math, high school world history, international law, and philosophy. And they wanted to quantify this, what you see on the graph to the right, to get the correct answer, how many grams of CO2 were emitted per answer. And I think this graph is really interesting because it really gets at this idea that, different AI models across different tasks can have the same levels of accuracy, but some of them emit almost 5x as much for that specific task. If you look at that top row on that graph, you have 4 different dots that are between 70 to 80%. But the DeepSeek R1 model all the way to the right there has, 5x the CO2 as one of the models to the left. The thing with this paper, though, is all of the models they looked at were open source models. So they looked at 88 models, all open source. So, this doesn't include ChatGPT, it doesn't include Claude, it doesn't include Gemini. They're all closed source. And so we don't really have great data on a lot of closed source models, but we are trying to get to our best estimates. But this was some of the background work that was really inspiring and led the setup for the SAHAI framework paper. And so the rest of the talk, I'm really going to go into this paper that we published, the framework that it sets up, and where we're kind of taking this next. And so our team of interdisciplinary researchers includes physicians, and I'll talk a little bit more about some of the specific folks. So Anu Ramachandran was our lead author. She is an emergency medicine physician and clinical informaticist at UCSF. And I'll highlight some of the other speakers as we move forward. Vivian Lee, who's our senior author, is a radiologist, but has held many healthcare executive positions. She was the CEO of the University of Utah healthcare system, on the board of Boston Children's Hospital, and speaks to a lot of healthcare executives on this vantage point they have of where they are, rolling out AI tools, but they also have made sustainability commitments. And so she speaks to a lot of healthcare leadership on how to balance these sometimes competing thoughts. Udit Gupta, who's also a colleague of mine and professor at Cornell Tech, is a professor in electrical and computer engineering. And his background is actually in sustainable computing. And he has experience working in big tech in roles in big tech in reducing their environmental footprint. And now is fully in academia and trying to address the footprint of computing. And so one of the first tables that we have in the paper starts off by just talking about where do emissions from AI models come from in healthcare, but also just in general. You could think about AI model development and models in three phases of development. So there's the development phase where new models are being created. This is, the creation of GPT-4, the creation of GPT-5. These don't happen as often, but this is where the most energy use happens. And a lot of the emissions come not just from the energy, but it comes from a lot of the hardware, which is scope 3 emissions. It's all of the equipment, the GPUs, the servers, the transportation to set up these massive data centers and train these really massive models. From a healthcare system perspective, most healthcare systems are not developing their own models, neither are public health agencies, but they may be training models where you're taking a base model like GPT and then training it on your specific data that gets fine-tuned, that starts to predict something specific. And here it's a lot of the emissions really come down to electricity and cooling. But then a lot of the emissions, really, from most people's use is inference. Every time you're going to your favorite AI tool, putting something in the prompt, every time you're doing that, there is a certain amount of energy use. The relative energy use is low, but the frequency is very high. And we wanted to better quantify what this looks like around one specific use case in healthcare. And so at the time we were publishing this, a lot of healthcare systems started to roll out AI-based draft replies to patient messages. And so many health systems that are using the Epic electronic health record system were deploying this tool where when a patient sends a message to their clinician, an AI tool looked at that message and generated a draft reply, and then the clinician could either send that draft, edit that draft, or delete it completely. And the way this implementation works is there's an incoming message from the patient. And what's interesting here is they actually used a mixed model approach, which I think is important to keep in mind, where they actually use GPT 3.5, which uses less energy from some of our calculations, which are still really back of the napkin calculations because OpenAI doesn't reveal a lot of the underlying architectural data. But from what we are able to surmise, GPT 3.5 uses about 10 times less energy per query than GPT-4. And we're already on GPT-5. But what's interesting in this setup is that when the patient message comes in to where it says Epic in-basket pool, GPT 3.5 is used to classify, to categorize the patient message to figure out, is this a message about medication refills? Is this a message about new symptoms? There are a list of 5 categories that this tool classified. And so it's interesting to think about with all the different AI deployments that might be happening out there, how do you use a combination of models where sometimes you might be able to use models that are less intense or even not use a large language model, but use an NLP, natural language processing tool that uses much less energy to do a simple classification task, and you don't have to throw an LLM at everything. But then what happens is it takes that category and then it starts to put it into a prompt, but it also combines it with smart data elements. And so this is structured information from the patient's chart. It is the patient's problem list, it's their medication list, it's their list of allergies, and it is their last clinical note, the note that their clinician wrote about their care, but it just takes one note, puts all that together, sends it to GPT-4 to generate the draft that you saw, in the previous slide. And so what we started to do, this is really table 2 of our paper, and I'll kind of orient you to this because it starts to get a little bit intense. So we wanted to calculate for this particular implementation, which was based on the implementation at Stanford, what are the emissions generated to run this one particular AI tool? And so that is the base case across the top. And so we took this implementation that they had and across there's these different input parameters that go into the calculation. So the input size, this is that structured data element plus the categorization of what goes in. And you can think of this as input tokens, but we translate it to words just to be a little bit more clear. Um, and then the model size, this is our best estimate of GPT-4 based on open source benchmark models that are roughly the same size as GPT-4. A lot of it goes into the type of model and the number of parameters. And then the data center efficiency and carbon intensity. So data center efficiency is measured by PUE, and it ranges from 1.1 to 1.4. 1.4 is the least efficient, 1.1 is the most efficient. And so if you're running this within your own healthcare systems data center, probably less efficient than a big tech company's ultra-scalar energy data center. And then we looked at the carbon intensity of that energy grid, and the 300 grams per kilowatt hours is the average intensity of the US grid. And so if you look at all of that for one hospital, this one implementation of this AI tool with their kind of estimated frequency of use came out to roughly 48,000 kilograms of CO2, which roughly translates to 2,300 tree years, or the number of trees you'd have to have either plant or have newly that would absorb that amount of CO2 from the atmosphere. And if you're asking yourself, like, what is that number compared to other emissions from a healthcare system? We started to do some of the math in terms of that absolute comparison, but it gets a little bit wonky. But what we really wanted to show here was not the absolute number, but the relative difference. Because, say, for example, in your input parameters, instead of putting one clinical note, you said, hey, we need to increase, to get the message to be better, we need to use 10 clinical notes that go into the input token size. If you change that, your CO2 emissions on the go up by 3x, right? So you're significantly increasing your emissions by changing your input token size. It's not necessarily a one-to-one relationship, and this is where this is based on a lot of the kind of mathematical modeling that Gupta led, based on his experience in this space. But you can maybe choose a leaner model. Maybe you don't need GPT-4, you can use GPT 3.5. And so if you do that, your emissions go down by nearly 1/6. Or you can use a greener a data center that's more efficient or is powered by renewable energy. And that also reduces your emissions by nearly a fourth. And so what we want people to take away from this is that with every implementation of AI in healthcare, whether it's at a healthcare system, public health agencies, across all these different domains, from how the application of that tool works to the model that you're using to the data center that's powering it, these small decisions can significantly change your overall emissions on a relative count. So, you could potentially increase, if you look at option A plus B, we have, 10 clinical notes, but if you combine that with a leaner model, you still have only half as much emissions as the base case. So there's a lot of complexity that goes into these decisions, but also a lot of levers for change. And so in this single use case, although the absolute emissions may not be exceedingly high, Health AI's footprint can rapidly accumulate when you consider hundreds of different tools for communication, for clinical decision support, or predictive modeling. And so this takes us kind of in conclusion to the framework that we built. And this framework was really based off of one of our co-authors, Shomit Ghosh, who is an engineer, but also a venture capitalist who lectures at UC Berkeley. And he really brings in an interesting perspective because he speaks to a lot of, AI startups that are thinking about this as well and wants them to think about this from the earliest stages. And so this framework that he created that we built ours on top of really has kind of policies at that top level, policies around what can these AI tools be used for at your organization or at a societal level, or who gets to make those decisions, all the way down to the data centers themselves. And so when you think about how this comes into healthcare, what we started to do in this is the final table in our paper. At the policy level, there are kind of national policymakers, federal, state governments, groups like the Coalition for Health AI, who are trying to figure out, how do we come up with safe, responsible, trustworthy AI guidance, and what our argument is, and all of those frameworks and discussions about making sure AI is safe, that it's trustworthy, that it's not, that we understand its biases, that we need to have environmental considerations in the footprint, that has to be part of that conversation. And this is also happening at an institutional governance level. I've been invited to speak and share this framework to some large healthcare systems in terms of their internal AI governance teams, and they're starting to think about this, but a lot of challenges remain because we don't have enough quantified data, and I'll get to that in our next steps. And when you think about that application orchestration, so I talked about, which model to use, but there's also questions such as when our models run. So for example, you may have an AI tool that's doing non-urgent image processing, and that can maybe be done when the grid demand is lower. And so that, could happen at midnight, from midnight to 2 a.m. But that requires careful collaboration between clinical leadership, IT leadership, between health systems, EHR vendors, data providers. So there's a lot of, interdisciplinary work that needs to happen there. And then you get into the model level, there's a lot of work that's happening with model developers of reducing mathematical complexity that reduces the overall emissions and energy needed to be able to run any particular inference. And then at the data center level, there's a lot of innovation that's happening in data center cooling and data center design. But oftentimes these pressures to choose a better data center really requires on healthcare systems asking the questions, right? If a healthcare system is deciding to implement a particular AI model, sometimes the model developers do, most of the time actually, model developers may not know what the emissions of running their models on the data centers are. But healthcare, given its purchasing power and scale and size, by asking these questions can help to create and shed more transparency. And so this is the framework paper that we created. And what we're starting to do now is, we only looked at one particular clinical use case. We know that AI is being used across a number of different healthcare use cases, number of different public health use cases. And so this is the beginning of some of the framing that we're starting to do of, if we look at ambient clinical documentation or chart summarization or imaging analysis or what's happening in AI for billing or AI in wearables, how do we start to estimate the relative and absolute emissions footprint. So this is still a work in progress that we're still refining, but we're starting to build these different kind of calculators, and we're speaking with different healthcare systems that are interested in quantifying this with us. And we have a more detailed worksheet that we're starting to share, where we're getting more actual usage data from healthcare systems that allow us to get from theoretical calculations to actual numbers. And so this is just a sneak peek of some of the work that's happening in the background. But to conclude, I think sustainably advancing health AI really has this broad responsibility around adopting AI in healthcare that should include considerations around its environmental footprint. Small design and technical choices can have a big difference in overall impact, as many decisions about AI now will become baked into the system for decades. And we really need to understand and consider the sustainability implications of AI in healthcare in context. And so we're starting to work with multiple health systems to validate our calculator use, as I mentioned. And we're working to build a coalition with organizations like AMIA, the American Medical Informatics Association, the National Academy of Medicine, and others. And for those of you not familiar with AMIA, it's kind of the professional home for academic informatics work. We have this Climate Health Informatics working group within the organization there. And if any of you are interested, feel free to reach out to talk to me about AMIA. If you're part of AMIA already, you should join. So Manny Berenji is currently the chair, and I'm the chair elect. And then I also wanted to mention I work with this nonprofit called Health and Climate that was started by Seema Wadhwa, who used to lead sustainability for Kaiser Permanente. And we've been working together on organizing these hackathons. So if you go to Health and Climate AI, has more information about the hackathon that we hosted last year in New York. But we're also going to be hosting one in London this June with London Climate Action Week, one in New York again for New York Climate Week, and then one in the West Coast in San Francisco in October. And so we're going to have more information on the website, including information about sustainably advancing health AI here. So a good resource to continue to follow that'll be updated. And so with that, really just wanted to thank you for all of your time and happy to take some questions.